my name is Lauren, and I'm going to be a student nurse that's working with you today. How are you feeling? I wash my hand. I'd be sure that I wash my hands. Can you state your name and date of birth for me, please? He would say Arnest David, date of birth 3/24/47. And I'm making note that he has a fall band on, that his wristband identification band is on correctly. I would assess the room, notice that he's a male. His bed is slightly up, he's laying in bed, he has blankets on. He is not currently hooked up to his IV pole, and that I would check to see if any lines and drains were all there. His environment looks safe, his call light was in place. I would then assess his level of consciousness to be sure he's alert to place, time, and who he is. I would look at his skin, see if he's flushed, if he's sweating. I can feel for temperature on his arms and his face, see if it's flushed. I'd also look for it being pale or red. I would then assess his bilateral pulses by feeling to see if they're equal and pumping at the same time, and if they're strong or weak. I would have him grasp both my hands at the same time to test for strength. I'd also look at cap refill to be sure that it's less than 3 seconds. While doing all this, you can also look and check the temperature of the skin and look kind of on the arms and things as you're doing that for lesions. I would also check his IV site to be sure it's clean, dry, and intact, and note if there was any redness or swelling or dry or wet drainage. I would then move onto my vitals. I would check his blood pressure, then his pulse on his arm. If I can't find it there, you can definitely listen to it apically. I would then do his temperature, respirations, and ask him what his pain level is, or assess the pain level via a different scale if he's not able to communicate that to me. I would then next move down slightly, check for symmetry while breathing, see that his chest rises and goes down evenly on both the left and right side. Palpate for tenderness on his chest, for crepitus. Look for any lesions or unusual bumps, bruises that should not be there. If they're hooked up to tele, make sure all places are connected. I would then listen to his apical pulse right here, and I can get a pulse, a heart rate that way. Check his heartbeat, make sure it's even. There's an S1, S2, that I don't hear any murmurs. I then listen to his lung sounds, and I'm listening to be sure there's no crackles, wheezes. Listen for if they're diminished and clear. Check all these spots. And down. There's 6 spots on the front. I would then have the patient sit up forward so I could listen to his breath sounds in 6 different spots on his back, starting at the bottom, moving my way up. I would then move down to the abdomen. Again, look at the abdomen, see that the color is appropriate, if there's any lesions, scrapes, or whatnot, and listen to the 4 spots on the abdomen for bowel sounds. You can listen to each of the 4 spots for up to 5 minutes, see if you hear bowel activity. I would also ask the patient about if he's passing gas and has been going to the bathroom regularly, or when his last BM was. After that, I would recover up the chest area and move down farther. I would assess his peri area and look for any abnormalities. If he has a fully catheter in, this would be the time I would check to be sure the catheter is connected down to his bag all right, check the drainage, color, and the amount. I would then move down the legs, feel for temperature, and look for, again, abrasions,